Welcome to Happy Hour Headlines, where we kick back and get real about the things that matter most for your health and well being. Today's guest is not just any expert in the medical world, he's your gut savior. Dr. Barwani, who goes by Dr. Sal, is known to over 100,000 followers on Instagram as Gut Savior. He's a board certified gastroenterologist who's breaking down gut health in a way that's clear, compassionate, and refreshingly honest. From IBS and the gut brain axis to natural remedies, hypnotherapy, fiber, and probiotics, we're covering it all. Thanks for joining us, Dr. Sal.
Thank you for having me, Allison.
I'm
Delighted to be here.
I'm so excited for this conversation because I have dealt with gut issues all my life. So selfishly, I'm just excited to have you in front of me and be able to ask you all sorts of questions. So the first thing I want to break down is what is going on with our guts. So many people are having gut issues, and I would love for you to break down what's going on.
So, the biggest change that has happened over the past 50 years is our fiber intake has gone down. So, if you look at 100 years ago, the average human consumed 70 grams of fiber. And today, it's less than 20 grams of fiber. And what's recommended is at least 30 grams of fiber a day. So, as the fiber goes down, the diseases of heart and cholesterol and blood pressure and all that you're seeing is actually affecting us, and they're going up, they're on the rise. So that tells you that gut health is the core to our complete health. And that's probably the biggest reason, the biggest change that has happened in our diet that has led to this significant rise in other illnesses, including colon cancer and heart attacks.
I've been hearing so much about colon cancer lately, especially in young people.
That's correct. And again, I would blame fiber for that lack of fiber intake because it has been said that just a handful of nuts, if you take, which is just a little amount, it can save, it can reduce the risk of colon cancer by 18% if you take it every single day. How
Okay.
difficult is that to do?
Yeah, it's pretty easy. Well, okay, so you mentioned nuts. What other foods are high in fiber?
So we have the biggest fiber contents are, again, they're deficient in our diet. You have legumes of all kinds. So lentils, chickpeas, and beans of all kinds. So everybody knows about refried beans, especially in the South here. But there are other kinds of beans that we're lacking. We're not using as much. And then you have so many kinds of fruits. Our intake is limited only to the apples and bananas, but there is so much more. In the berries, there is like high fiber content and so many other food items. You have chia seeds. Seeds are lacking in our diet. So you have all kinds of seeds that have significant amount of fiber. But chickpeas, if you take 1 cup, you're getting 30, 40 grams of fiber right
Oh,
away.
that's easy. Okay,
That's
so you
easy
can
to
hit your
do.
goals.
1 cup of lentils, 1 cup of chia seeds
That's
gives
so
you 30 to
reasonable.
35, and you're done for the day.
Okay. Yeah, because sometimes doctors will come on and say, oh, you need to be having 5 servings of probiotics every day. Like, who's eating 1 serving of kimchi and 1 serving of yogurt and
Right.
sauerkraut and all these different things? It's very specific. This is so reasonable. Anyone can do that.
Right,
There's so
right.
many
So what
options.
the so doctors are what doctors are saying, the probiotics part is also very true. But what you need is just 1/2 cup twice of yogurt if you take in a day, that's enough for probiotics. Or
Okay.
if you can make your own pickles by salt and water, favorite vegetable, salt and water. Don't put vinegar. Vinegar reduces the life of the bacteria.
Mm.
And if you like bread, sourdough bread will give you fermentation and actually give you the probiotics that you need.
These
So
are all
even
delicious foods.
they are all delicious food. It's all possible to do that. And prebiotics are all soluble fibers. So you once you're taking enough of fiber of all these lentils and all that I talked about, you are covering your prebiotics.
Okay.
So you have your probiotics, you have your prebiotics. You don't even need much supplements from outside world.
That's good to hear. I'm relieved. I was nervous that you were going to say we need a lot more. So that's reasonable. Now, you talk a lot about the gut-brain axis. For those of us who haven't heard about this before, can you break it down and explain it in simple terms?
So the most important way to understand the easiest way is I use the analogy. that gut and brain is like partners in a relationship. Okay. So you have to have a good relationship, and gut and brain have so many hormones and chemicals in common with them. So, for example, serotonin. Only 5% of serotonin is secreted in the brain, 95% in the gut. So
Mhm.
gut is a heavy nervous tissue. Gut is the biggest immune organ. Gut is the second largest nervous tissue. So between gut and the brain, there is always communication. And 75% of the communication gut sends to the brain. So brain actually is a CEO of your body, but with the gut, it has a very special bilateral relation. Even if they're removed, gut can operate independently. So it's like a second brain now. So we understand that because of these chemical imbalances between the gut and the gut starts feeling distressed, and you have irritable bowel syndrome, and you have functional bowel disorders like dyspepsia. And these conditions are becoming more common because between the gut and the brain, the biggest mediator is your gut microbiome, which is 1 trillion bacteria in your gut sitting there creating this communication flow. And if that bacteria are disturbed, the brain starts feeling anxious, you get anxiety and depressive disorders, and the gut starts having irritable bowels. No wonder if you have IBS, you have a 70% chance you're going to have anxiety disorders, and vice versa. So that's why we're learning more why gut microbiome is so important in the gut brain axis communication.
Let's dive into IBS. Can it actually be diagnosed? Because last I checked, it seemed like a lot of people say that they have IBS, but they haven't been officially diagnosed. Like, what is the process of confirming if you have it or not?
That has been my experience time and time again in the clinic. So, yes, IBS has a diagnostic criteria, but you cannot still self diagnose. That is the problem. You need a gastroenterologist to help you with the diagnosis. But yes, if you fulfill certain terms, then you can be 70 to 80% sure you have IBS. But what you need is somebody to help you diagnose it and make sure that other diagnoses are not confounding.
Mhm.
So that is the reason why I give the criteria. The criteria is you have to have belly cramping, abdominal cramps, but with changes in the bowel movements. So you have either constipation, or you have diarrhea, or you have mixed constipation and diarrhea, or you have unclassified, which is like everything is going haywire, like when the poop hits the fan kind of feeling. Then the poop's everywhere, so you
Mhm.
can't really tell. So you have diarrhea dominant IBS, you have constipation dominant IBS. Each of these are like in diarrhea dominant, you have more than 25% of the time you have diarrhea. Constipation dominant, more than 25% of the time you have constipation. In mixed, you have mixed constipation and diarrhea for the most part, rather than normal bowel movements. So if you have abdominal cramping with any of these changes in the bowel movements going on for more than 2 to 3 months, and at least 4 times a month you're having, once a week you're having these kind of symptoms, then you can be quite certain that you have IBS. But now the confusing part is that there are some conditions that resemble IBS. So that's why there's a danger in self diagnosis and thinking, yes, you have IBS. Yes, you are 70% correct. But what about those 30% of the time? You may have celiac disease. So, celiac disease is that you have gluten problems.
Mhm.
You don't digest gluten really well, and your bowels are actually inflamed, and the villi, the absorption surface is lost in your small bowel. That's the celiac disease with gluten problem. So you can't take barley, rye, and wheat in those cases. So celiac disease is a very quick diagnosis. You can do a blood test. The doctor can do a blood test, look for antibodies, and if they're positive, you have celiac. So, and the other thing that mimics IBS is SIBO, or small intestinal bacterial overgrowth, where you have this bloating, you can have, the symptoms of bloating and gas, which can also be with celiac. And celiac can give you diarrhea and constipation.
Mm.
So that can be confusing also. So that's why a gastroenterologist has to rule out other things. And if you are in your 30s and 40s and 50s, you have to make sure that you don't have colon cancer and those things, right? So you get your quickly endoscopy, colonoscopy done, get those things out of the way, have a diagnosis, and then we can deal with it.
So it
But if
sounds like
you,
you're saying anyone who's having gut issues should see a doctor.
I think they should immediately see somebody and not just keep imagining and not worrying because one of the reasons why I came on board here as a gut saver, the reason is that I want people to feel completely comfortable in accessing their gastroenterologist. But even before they go, I can actually give you a guidance. I can create a personalized plan for you to ask the right specific questions to your gastroenterologist. So you go armed with knowledge, you go armed with the right kind of questions, and you get the right answers. And once you have the answer, we can create a path for you, a gut healing pathway. We can create it. So I don't want people to be shy or embarrassed. I don't
It's
want
scary,
people to.
doctor.
Yes,
It's
it is. It
embarrassing.
is. It is absolutely, yeah, you are right. To go to the doctor, you feel scared, but the chances are you don't have cancer. Many of the times you're just worried. And, the irritable bowel syndrome can be diagnosed. In youngsters, it is always possible without colonoscopies. But if you have certain red flags, then it's not irritable bowels. For example, if you are telling me that you have blood in the poop, that's not IBS.
Okay.
It will not give you bloody poop. If
Hmm.
you're telling me you're losing weight, IBS should not do that.
Hmm.
If you're telling me that you have severe vomiting, that's not IBS.
Hmm.
So there are red flags. If you have these red flags, you have anemia, you have iron deficiency, you need colonoscopy and all that to reassure you or to diagnose you early on with something that is always treatable. So that's why if people think that yeah, it could be IBS, but there are red flags that you think of that's not IBS, and that needs a different kind of attention.
Okay.
But if
So
you
let's
don't have, yeah. So you have to have no red flags when you have those criteria that I mentioned with the IBS thing.
Okay, so go see a doctor. If you're watching this video right now and you think that you may have it, but you're not sure, go see a doctor to
Yeah.
confirm.
Because
Now,
once you have it, then then the rest is like we can deal with it. There is
how
a
do
way
you
to
treat
manage.
IBS? Once someone is diagnosed, how do you treat it?
Yes. Okay. So then again, well, I don't use the word treatment because treatment is for disease, right? So IBS is like an illness that you manage. So you manage it in a way that you do everything for your brain and the gut health. First, you focus on your gut microbiome because that is where everything starts. It is like imagine gut and the brain are like a couple who are either they are completely in harmony or they are in disharmony. And imagine gut microbiome to be the environment,
Mhm.
the children, the in-laws, the finances, the all the other things that are happening around you, around that couple. And if they're all healthy, if the surrounding environment is an enabling environment, the couple is enriched, taking care of each other, that's perfect harmony. So imagine gut microbiome to be everything around that couple of gut and brain. So you have to focus on that first. Even if you need short time for good probiotic treatment, you do that for irritable bowels. A good supplement of probiotics that are available that have been studied, although the grades or level of evidence is not A grade, but it's still out there. There is evidence, and there are products. People get frustrated with the millions of products around them, but there are some that have been studied, it have been mentioned in the literature. Why not go for those and try them out for a few months? But they're not long term. Okay. Long term is what you're going to eat, the probiotics and the prebiotics and the food that's going to carry you on for the future. So, initially, probiotics is a good way to start for IBS. Then you need some dietary changes. There are high oligosaccharides containing food, which are not going to be good for you because it's going to create a lot of gasiness and diarrhea. So
Like
you
what?
like apple, you have onions, you have garlic.
Wow.
Those kind of food are there, like peaches, pears, and plums. Those are high oligosaccharide containing fruits and food, and many of them are like have the wheat itself, the barley. They may be the rye, they may be good for you, but sometimes they have high FODMAP. We call it high FODMAP food.
Mhm.
With FODMAP stands for like fructans, oligosaccharides, disaccharides, maltylols, and then your other alcohols, sugar alcohols. And so those are the high, if they are high in the food, they will lead to more diarrhea and gas. So initially, you have to avoid that high FODMAP and move on to low FODMAP diet. Like berries are going to be good for you, banana is going to be good for you. Those are like kind of food changes you will make. There's a long list of high and low. But the problem with that dietary change is that cannot go on forever.
Mhm.
You do a short course of 4 to 6 weeks, but then you reintroduce one food at a time, which you are avoiding, to find out which was the culprit that makes your gut
Uh,
difficult.
okay. So it could
And
just be
there
one.
and then it may be one or two items. So why do you avoid all the high FODMAP food? So
Okay.
you reintroduce, find the culprits, and then you change your diet accordingly and go back to, because imagine that all these high FODMAPs, they are also soluble fiber. They are also prebiotics that your gut microbiome needs.
Are there certain oils that you find trigger people? Because there's this restaurant chain in Tampa where a lot of people I know, we say it's healthy food, but our stomachs always hurt after eating it. And I'm wondering if it's the oil or something. Have you found
It,
like seed oils or anything like that can
that
inflame?
is, this is a very good question you're asking, because seed oils that are used in are actually not good for you. And most of the food items, people say, like, seed oils are okay. And some people say they are not okay because they are used in prepackaged food and in preserved food. So they undergo changes. But now we have found the recent evidence that seed oils, the way they are prepared, are not healthy ways of preparing it.
Okay.
So even then, that there is toxicity there, so they will not be beneficial to you in the long run. So seed oils I would avoid.
Okay.
I recommend avocado oil, I recommend coconut oil. If you're cooking with these two, you are in the best care.
Okay.
So
Yeah.
they're going to be best for you, and they will not give you those kind of feelings you get when you eat outside.
Okay.
So yes, to your question, a simple answer is seed oils are not good.
Yeah, we've been hearing a lot about seed oils lately. So that's
Yeah.
interesting to hear. It sounds like it can negatively impact every aspect of your health. So I've definitely, just to share a little personal information, I used to have gut issues, and then I recently cleaned up my diet within the past year or two just to eat pretty clean and cut out seed oils, and now I feel great. No stomach issues at all. So I definitely can attest to the fact that cutting out, and it may not just be the seed oils, it's probably the preservatives and other junk that goes into our body, but
Right. Yeah, the diglycerides and other things that people are using, to preserve that. Any packaged, prepackaged food that is up there on the shelf, like cookies and chips and all those things, are not going to be beneficial to us. That's why we're focusing more on the nuts and the seeds, and
mhm.
healthy snacking. The healthy way of snacking will always be good for you.
And the
And
brain
if you
loves
feel
them. The brain craves, I mean, they've cracked the formulas to make us really want these junk foods. So that probably plays into the gut brain connection.
that is true, it has been a survival mechanism for us, right? From ancient times, if the food is sweet, anything you touch is sweet, it may be good for you. If it's
Mhm.
bitter, you avoid. So we are trained, our brain is geared toward that. But you will notice that once you stop the sugars, cut down on your sugar intake, every time you will try something, you'll feel it right away that it is out of balance.
Yeah,
Just
Absolutely.
try it for 2, 3 weeks and then you try something sweet. You'll know the sweet content is more than what your body wants.
Yes.
So, because it's disturbed already, we cannot tell anymore. We
Hmm.
keep craving. But once you, as you said, you reset your gut by
Hmm.
eating right, within 2 or 3 weeks, you will know. If somebody offers you some kind of sweet, you touch a little bit of donut, you'll know you're not doing it. Something's off.
Absolutely. Can we dive into the fake sugars for a moment? There's a lot of alternatives like stevia and it starts with a Z.
Yes. So
Stevia, maybe?
yes. So they have worked really well to transition the diabetics and the obese people to get them off of sugar.
Hmm.
So it has been great in terms of transitioning. So they have played a role. But
Okay.
in common people, in general, in regular healthy people, we don't need any kind of sweeteners either. What the sweetener does is it tries to fool the brain. Okay, so it tells the brain that sweet is there. When the tongue tastes it, it sends a message to your cortex saying that, yeah, sweet is here. But when the blood sugar doesn't rise with it, the brain feels frustrated. And the brain thinks that whatever has come is not enough. So you
Mhm.
crave for more.
Okay.
So that's the reason why you go for Diet Cokes and Diet Pepsis and diet drinks. Your intake, you will notice over the year, is going to keep increasing. You will notice very rarely, but it is happening. Like 1 cup you're taking a week, you're gonna get two soda cans in a week, then 3 soda cans in few weeks after that, because the brain realizes that it's been cheated. It wants more of that to derive that sugar
Okay.
that you promised by the taste,
Well, I
right? You
feel
didn't
like
deliver. You didn't deliver.
this ties really well into hypnotherapy. I'm
Yes.
very interested in talking to you about that. So, if the brain's craving sugar, is there a way to fix that with hypnotherapy?
That's a very good point. So hypnotherapy is good in fixing so many things like anxiety issues, stress levels, and even your gut specific. We do gut specific hypnotherapy. So actually it calms down your gut. It's again tells it gives more authority to your brain and the subconscious brain. So lately we have learned so much from Mind Valley and other, people who have talked about manifesting reality and the brain and the subconscious brain. So this is what happens. So when I take you to hypnotherapy, by the way, hypnotherapy is not that Hollywood style, making somebody a puppet and make them do things and you are not in control. In hypnotherapy that we do, you are totally in control and you can stop us anytime. Idea behind hypnotherapy is that we take you to from your conscious to slightly subconscious level, to that level of peace and rest and restoration where your conscious mind is not cynically questioning everything. If I tell you now that hypnotherapy works, you will say, yeah, maybe, yeah, right. But when you go through the hypnotherapy and I tell you when you're at the subconscious level that this thing is going to work for you, you're going to say, maybe yes,
Mm.
it will. So if I tell my patients that your gut, you don't have any disease, you have illness of this IBS, your gut is extraordinarily visceral, hypersensitive. We need to keep it low sensitivity, and it is going to get better and better. You're not going to question me when you're under hypnotherapy because your cynical mind is resting
Okay.
and your subconscious mind is accepting that fact that
Mm.
I'm healing. I'm going to get better. My gut is getting better.
Oh,
The
and if
gut
the brain believes it, then the gut will start to feel
it's
it.
with have will figure it out.
Wow. That's great.
So that's the crosstalk you take advantage of between the gut and the brain. There's also guided imagery. Like you can see the images. Believe that if you have IBS diarrhea, you can actually image that your gut is slowing down
Mm.
because you have diarrhea, so your gut is slowing down. And if your gut is so slow, like you have constipation, you're imagining the gut is picking up pace.
Wow.
So that kind of self hypnosis also helps in guided imagery. We take advantage of that.
Never heard of that before. That's
So and,
brilliant.
and the beauty of this is that there is data. What I'm talking is not hodgepodge because it's published in literature. Hypnotherapy works in 65 to 70% of the cases. With 6 sessions, the IBS patients were 2 years out without symptoms, with
Amazing.
only 6 sessions.
Wow. Okay.
This
Yeah,
is the
that's amazing.
proven data, published data.
Wow. Is this something that has to be done in person, or can people find a doctor and do this remotely?
You can do it remotely. And in fact, there are like, we can have recorded sessions already. You can download from the website. I'm planning to create that on my site. You can download and you can do it. First session you can do remotely, but then you can just listen to it at your, and it has been shown that even the remote versions and the audio versions have helped tremendously in hypnotherapy outcome.
What is your website?
It's thegutsavior.com.
Okay, perfect. I'm sure people
You,
are wondering right now.
thegutsavior.com. I
Easy.
couldn't get thegutsavior.com because somebody's sitting on it and has forgotten about
Yeah, the internet's
it.
too old. It's so hard to find a good URL. And they're just sleeping on it. It's like I would pay you for it, but
Yeah, no,
they
then
don't
there's
check
no
the info.
answer. They have
Mm.
already forgotten themselves that it's gone, and but it's on hold
Well,
somewhere.
that's still easy to remember. Now, let's talk about other remedies. Are there any natural or herbal remedies that you recommend?
Yes, so there are peppermint oil has been studied and published data is there for peppermint oil.
Okay.
It really helps the dyspepsia feelings, the bloating. People have bloating issues all the time. So there is this product that is available in Amazon now, and I must confess that I am disclosing, I have no connection, I have no interest in this product. But the product has been shown, it has peppermint oil. It's called FD Guard, and we recommend it in clinics to patients. This FDGARD is available, and it has peppermint oil, and that has been shown that it helps bloating like within an hour and a half. Or if
It's
you
also good.
you take it before a meal, no bloating.
That's great. Well, and then they could take that on the inside and then they could wear it on the outside and it repels bugs. It's a natural bug repellent, so it's a double
It's
win.
interesting, isn't it? Yeah, peppermint oil has a lot of benefits and they have been studied well. So FD Guard is something I have no financial interest in it, but I feel it's very important for people to know this product. And we recommend it in all the patients who have bloating. They come to my clinic and it is safe. So you can take it before every meal. And then there is another product which is has 7 different herbal products in it, 7 different herbs. It's called Iberogast. And initially, the first product was 9 of them, but then they found some liver toxicity. So you have to understand that not everything supplements that are out there are completely free of adverse events or free of side effects. So they had studied this so well, but then they found that a couple of the herbs were actually harmful to the liver. So they removed it, and the new products of Iberogast have 7 herbs instead of the 9 herbs. But
Okay.
Iberogast was found to be, we had recommended to many of our kids and patients who had this kind of symptoms of IBS that worked for them. So these are some of the herbal things, but mostly if you have, like initially I said, you use some probiotics, you use these supplements, but then as soon as you have a reset, like after the FODMAP therapy thing, once your gut is back to normal, then focus only on natural food items. Don't go for any supplement.
And
I
it'll
see
be good
like
for every aspect of their life, not just their
exactly,
diet, but every
exactly,
aspect of health is better when you're eating a clean diet. And clean can be fun.
exactly.
Like you said, sourdough bread. Who doesn't love sourdough bread? It's delicious. You can eat bread, you can still have desserts.
Right.
you can make clean desserts and yeah,
And
read
sugar,
about.
you have honey. You have
Mhm.
honey is a prebiotic.
What
So
about maple
instead of
syrup?
sugar, why don't you use honey?
Do you like maple syrup too?
Maple syrup in its pure form is also okay in a small
Okay.
amount, but again, anything syrupy or liquidy which has can raise your sugar a little faster.
Okay.
So even honey in the large amount is actually eventually converts to sugar.
A little bit of honey.
Yeah, a little bit of honey, but you can use it, I would say, to cook it for desserts. And the thing, Alison, is that our ancestors knew all these things.
Hmm.
I went to Egypt, and this ancient pharaohs, they knew how to prepare the desserts.
Hmm.
They had pomegranates, which are rich in prebiotics. They had honey used all the time. 3,000-year-old custom to use honey and in your desserts, and pomegranates rich in prebiotics. So they knew exactly what they were doing. They prepared in Indian culture. You have lassi. They made with yogurt drinks.
Hmm.
And in Middle East, they have labna, again the yogurt drink, full of rich probiotics.
Coffee and
So
alcohol. How do you feel about them?
coffee and alcohol.
Yes.
Um, well, alcohol is not going to be beneficial in any ways. I mean, in fact, we're learning more and more about the more you are contained about the alcohol intake, the better it will be for. Coffee is mysterious. Coffee is mysterious. Coffee can be beneficial to you in many ways, but again, I would say in moderation. It is, and it has a lot of, it is still being studied. It has a lot of properties. It can help you with, some people say constipation can get better, for some diarrhea can get better, but it reacts to individual gut differently. So it does some things for you, and I am a minimum consumption of coffee and tea. Tea is our custom, like from Indian tradition and British traditions. So coffee came in late after I moved to Canada and United States, and that's where I learned to get the Tim Hortons and the into coffee. And so this is something that is still out there, but in moderation, I would enjoy.
Now, I have one final question for you. So, a
Yes,
very common gut problem that people face is when traveling, constipation while traveling. What do you think causes this, and what is your advice?
that is a very good point. I would say the biggest hindrance is not enough water intake.
Mm,
I travel with a liter of bottle that I keep replenishing it.
okay.
So when traveling and stuff, water intake goes down tremendously with dehydration. And with the pressure changes in air and all that, you are somewhat dehydrated all the time. So if and alcohol is worse when traveling and flying
Mm,
because it makes you more dehydrated.
yeah.
So you have to be careful in your water intake. Now, so that will certainly help a lot. And again, when you're snacking in flights and stuff, when you're traveling, why not take nuts, mixed nuts and seeds? They
There
offer
you
you
go.
sometimes, rather than chips and cookies or crackers, or pretzels, you have the option of nuts and seeds.
Hmm.
So if you carry some of those, you're not going to be constipated. The other thing I advise people, if you're eating kiwi or apple, eat with skin. Skin is something your gut doesn't like. It wants to get rid of it fast, so your constipation will get better.
Okay, that's good to know. I didn't know that you could eat the skin of a kiwi.
Yes, you can. And
So,
it is
yeah.
great for constipation.
Let's talk about fiber supplements. What is your thought on this? What do you recommend?
So, fiber supplements are extremely helpful. If your diet, like I said, if you can get 30 grams of fiber in a day, you probably don't need any supplements. But the best fiber supplement that has been studied well in literature and published is psyllium husk. Psyllium husk has a lot of benefits, but you have to remember it comes in powder form and it comes in tablet form, capsule forms. But the powder form, even 1 teaspoon has 4 grams of fiber. So if you take 1 teaspoon in a cup of water in the morning and 1 teaspoon in a cup of water in the evening, you are you get 8 grams without the food.
Okay.
So if your diet is lacking, feel free to use psyllium husk fiber supplements. Capsules are difficult because capsules are easy to take, but you have to take 8 capsules
Mm,
for two
a
teaspoons.
lot. Mm-hmm.
So because each capsule is only zero point 0.5 gram. So it's not fun to take so many because you have to take water with it.
Mm-hmm.
So I recommend fiber powder if you're taking it twice a day. Now I'm going to tell you how it benefits you. So the studies have shown that if you take psyllium fiber, it can actually provide you with satiety or satisfaction, and you don't eat much food after that.
Mm-hmm.
And you are well balanced. It takes care of your satiety, so you're not overeating, and it helps you not gain weight. That is an excellent tip for the weight loss or not gaining, extra weight
Mm-hmm.
with this psyllium fiber. The other thing it does, and it also slows down your gut, and it slows down the emptying of your stomach. So your stomach always feels a little full, so you don't crave sugars and other food. And plus, fiber cuts down the actual sugar spike. So if you're eating sugars, it lowers your glycemic index with this
Okay.
fiber.
So
So
add a
you're
scoop
not
of
gonna get
fiber when you're
so
eating
this
birthday
this
cake.
so that is an advantage. The other thing it does, it actually reduces your plaques in the arteries eventually to lower down the risk of your heart attacks and heart diseases
Oh.
over a period of time. And it lowers the risk of colon cancer. So, what other thing is going to give you so much benefits? So, that is one thing I want people to know about psyllium husk. It is really, really beneficial to you if you take it in a small amount, even every day. It's still better to do it with the diet, but if you take this extra, it can help you in many different ways. And of course, the biggest thing is the constipation.
Mm-hmm.
This fiber, psyllium, will take care of the constipation part.
That's good to know. Well, thank you so much. This was extremely valuable information that I'm sure is going to help a lot of people. And anyone who wants to follow you, it's
Gutsavior@gmail.com.
wonderful.
It's very
Thank you so
simple.
much.
And thank you for having me and thank you for your time. I really enjoyed it. Thank you.
All the best.